Okay, we're doing part 2 now of this book here, Prevent and Reverse Heart Disease by me, Pete Rogers. And we're on page number 14. We're going to be talking about Dr. Gregory Sloop. He's a famous pathologist. He's actually the best atherosclerosis researcher in the world. I was friends with him. I spoke to him on the phone many times. He is the pioneer of what is called the atherothrombosis. Athero for atherosclerosis, thrombosis for clotting. So he figured out a lot of stuff related to atherosclerosis being a blood clot. He showed that the higher LDL cholesterol gets, the higher the blood viscosity goes, meaning that it makes your blood thick. Why do you have a blood pressure? To pump blood against gravity to the top of your brain, your cerebral cortex. Okay, and if you make the blood thick because the fat from the LDL cholesterol, from the chylomicrons, or from the triglycerides is sticking the red cells together, then instead of pumping normal blood that's like water, you're pumping thick blood that's like a milkshake, so pressure has to go up. And then if you have sodium on board, salt, you vasoconstrict. Now you got to pump thick blood through a constricted system, and you get even higher blood pressure, which damages arteries. Okay. Rouleau is the French word for a stack of coins. Blood sludge is the other word for thickened blood when the red cells are sticking together. This is Dr. Sloop's book called Its Blood Viscosity, Its Role in Cardiovascular Pathophysiology and Hematology. And last time I checked, the price was really high, like something over $130. And that's called a paywall. If big business finds that a book is too useful, that people are starting to figure out what really causes diseases, one of the things they do is they'll hide papers in the journals. They'll hide them behind a paywall. And they'll also hide books. All of a sudden, that book will become way more expensive than it should be. That's characteristic of a way you hide a book behind a paywall, and that's what happened to Dr. Sloop's book. Okay. And we had a real interesting conversation with each other. It's like all of his ideas connected to all of my ideas, because I've been looking at catheter angiograms, CT angiograms, MRA angiograms for many years. Okay, and he's been looking at atherosclerosis under a microscope for many years, but everything all connected up. And, you know, basically he would ask me, well, can you tell the difference between a blood clot and an atherosclerosis plaque? I said, no, I can't. He goes, of course not, because it's the same thing. Okay? Ralph Waldo Emerson, in every work of genius, we recognize our own rejected thoughts. They come back to us with a certain alienated majesty. Okay, here's one of Dr. Sloop's papers about atherothrombosis is a thrombotic, not an inflammatory disease. Because sometimes people try to tell me, oh, atherosclerosis is caused by bacteria, because we sometimes find bacteria in plaques. But you don't need to take an antibiotic. You know, Caldwell-Esselstyn cured all his patients, you know, like 198, you know, call it 177 in a row, just by following his diet. They didn't need to take any antibiotics. They didn't need to do anything about their teeth. They just needed to fix their diet. You know, when you fix your diet, your oral health will improve too, but still, the diet was the dominant thing. Okay. So here's a normal red blood cell, and the negative charge drawn around it is called the zeta potential. Zeta potential means negative charge. And that's good. So the two red cells have a negative charge, so they repel each other, so they don't stick together. You don't want them to stick together. Okay? The lining of the artery is called the endothelial cells. That also has a zeta potential, a negative charge. The white blood cells have a negative charge. Albumin, the main protein in the blood, in the plasma, has a negative charge. They all have a zeta potential. However, there's bridging molecules, things that will stick red blood cells together. So imagine that my two fists were red blood cells. And then a bridging molecule sticks them together. So the bridging molecule here, which is this orange thing, will have a positive charge on it and be big enough in size that it can stick the red cells together. Examples of bridging molecules include LDL cholesterol, chylomicrons, triglycerides, IgM antibody, fibrinogen, and uric acid. The IgG antibody is a little one that just has one fork on it. It's too small. The IgM has a bunch of forks on it, so it's big enough to hold the red cells together. Okay. And remember, anything that's sticking red cells together is predisposing them to clotting, so it's going to increase the risk of atherosclerosis. So here's just a graph showing the higher the LDL cholesterol, the higher blood viscosity, and Dr. Sloop wrote about this in his papers. You can watch Dr. Sloop's video on the internet. I'll actually, reminds me, I'll put a link in the description below. It's called The Importance of Measuring Blood Viscosity. Okay, and I made several other videos about him and some of his papers and stuff. Okay, so here's something that you need to know if you want to understand atherosclerosis. You have to know this, that the typical capillary is 5 microns in diameter. The typical red blood cell is 7 microns in diameter. So what that means is the red blood cell is bigger than the capillary diameter, so it has to fold back on itself to pass through. So here you can see a regular red blood cell, biconcave disc, and then it folds back on itself to pass through the capillary. So it has to be very flexible. In fact, red blood cells are like the most flexible cell in the body. And they go through these 5 micron capillaries pretty easy. Typical life of a red blood cell is about 120 days, 3 months. They also have to go through these tiny filter-like sinusoids in the spleen that are only about 3 microns in diameter. So the older a red blood cell gets, the more glycated it gets, like elevation of hemoglobin A1C, for example. The stiffer its plasma membrane gets, the more it has what is called phosphatidylserine externalization, whereby phosphatidylserine is a phospholipid on the inner leaflet of the bilayer, and it flips to the outer leaflet. And the more of those that flip to the outer leaflet, the more stiff the red blood cell membrane gets, so the more likely it's going to be removed when it hits those 3 micron diameter filters in the spleen. This is also part of why women live longer. Women menstruate when they're premenopausal, and when they lose that blood on a routine basis, it lowers their hematocrit. So having a lower hematocrit lowers their blood viscosity. 99-point-something% of blood cells are red blood cells. There's hardly any white blood cells compared to red blood cells. So it's the red blood cells that are the dominant thing that determines blood viscosity. So when you have a lower hematocrit, meaning a lower percentage of red blood cells in the blood, you're going to have lower blood viscosity, your blood's less thick, you're going to have lower blood pressure. Having lower blood pressure helps protect you from atherosclerosis, because high blood pressure damages arteries and causes atherosclerosis. Okay, so that's number one. Number two, you're also going to have lower blood viscosity because you're going to have more immature red blood cells in the blood. What that means is, I just mentioned that the older a red blood cell gets, the more it gets glycated, the more it gets phosphatidylserine externalization to stiffen it. But think about a woman when she's menstruating, she bleeds out, and then bone marrow replaces those red cells by releasing new young red cells from the marrow. Well, it's going to release more young ones, which are more flexible. So she not only has a lower hematocrit, she also has more flexible RBCs, and that's thought to be the main reason why women live longer, because they're protected from hypertension all the way up until when they're postmenopausal. So that makes a big difference in decreasing atherosclerosis in the heart, the brain, and everywhere else. Okay. And the other joke is, why do women live longer? Because they're not married to women. Okay, that's the old one. Okay, here's rouleau formation. Again, this means a stack of coins in French, and this just shows a bridging molecule like we just talked about. Chylomicrons, triglycerides, LDL cholesterol, IgM antibody, fibrinogen, uric acid, sticking these red cells together. And then when they're stuck together, it's harder to push them through that capillary. It's like pushing a submarine sandwich through that capillary. So blood pressure has to go up. Okay, I'm going to get into how high blood pressure causes atherosclerosis in just a little bit. But for now, we'll just leave it at that for this session today. And I'm going to work through a couple more issues about blood flow, and then I'm going to get into how this all causes atherosclerosis and coronary artery disease and heart attack and stroke. So I hope you found that helpful.